over 60, then what I'm about to say may surprise you. After 60, the human body quietly loses around 1 to 2% of muscle mass every single year, especially around the hips, glutes and lower back, and this silent decline is one of the biggest triggers for sciatic nerve pain later in life. Millions of seniors wake up each morning believing their leg pain, burning sensation, or numbness is just normal aging. But when pain travels like a straight line from the lower back into the leg, sometimes even down to the foot, that is not ordinary back pain. That is a red flag that the sciatic nerve is being compressed, irritated, or inflamed. And ignoring this early sign can turn what could have been a simple 3-week recovery into a months-long struggle. What makes this more concerning is that sciatica often begins subtly. A person may feel occasional tightness in the hip after sitting too long, or a strange electric jolt when standing up. Maybe climbing stairs starts to feel heavier on one leg than the other. At first, these signs seem harmless. People push through them, hoping they will go away. But nerves don't like being ignored. When the sciatic nerve becomes irritated, it speaks in a very recognizable language, a burning line, a tingling path, a deep ache that moves rather than stays still. If you've ever felt a sensation that travels from the spine, through the glute, down the thigh, sometimes into the calf, or even to the toes, you may already be familiar with that language. The interesting part is that sciatica pain behaves differently from muscle soreness. Muscle pain is dull, spread out, and usually triggered by overuse. Sciatica is sharper. Some seniors describe it as lightning inside the leg, others as a hot wire. Standing up from a chair can send a shock down the leg. Sitting too long can create a burning feeling near the hip. And the more the nerve is compressed, whether due to weak muscles, spinal narrowing, or tight piriformis, the more aggressively it speaks. One of the clearest clues is what happens when you sit. Many older adults assume rest helps, yet sciatica often worsens with prolonged sitting. The nerve gets crowded, pressure builds, and within minutes the discomfort starts to crawl downward. But then something strange occurs. When they stand and walk slowly, the pain sometimes eases. It returns later, especially at night, when the muscles cool down and the body becomes stiff. This pattern, worse when sitting, relief with gentle movement, is a classic signature of sciatic involvement. Another early sign most people overlook is numbness. When a nerve is irritated long enough, the brain receives weaker signals. A person may press their leg with a hand and feel less than usual, or they might notice pins and needles along the calf or foot. Some describe patches of skin feeling cold or sleepy. Others notice they trip more easily, or their foot doesn't lift as strongly while walking. This is not simply age. The nerve is being compressed the same way a garden hose bends when stepped on. Water still flows, just weaker. If pressure continues, flow decreases more, and the longer a nerve stays compressed, the harder it is to calm it later. That is why catching sciatica early is so important. What begins as mild irritation can evolve into weakness, reduced stability, and long-term mobility loss. There is one more detail many seniors never connect to sciatica. When they cough, sneeze, or laugh strongly, the pain suddenly intensifies, shooting downwards faster than usual. This happens because internal pressure rises during these actions, pushing on the nerve root. If you've ever coughed and instantly felt pain radiate down your leg, that is a textbook neurodynamic response. It means the nerve is already sensitive. Add sitting, muscle loss, and inactivity to the equation, and the discomfort slowly becomes persistent. This is the point where Western and Japanese habits create two very different outcomes. In America and Canada, most older adults respond to pain by resting more. They sit, they avoid walking, they take painkillers, hoping it will resolve. But rest without strengthening leads to further muscle decline, especially around the hips and glutes, and the sciatic nerve loses even more protection. Painkillers numb the signal, but the underlying mechanism continues quietly, and after weeks or months, the pain returns stronger or more frequent. In Japan, however, seniors approach aging differently. Instead of withdrawing into rest, they maintain gentle daily mobility, slow walking, joint rotation, hip activation before bed. Their rituals keep blood flow moving, reduce muscle stiffness, and allow the sciatic nerve to glide freely instead of being trapped. That is why seeing 80 and even 90-year-olds walking easily in small Japanese towns is not rare. Their lifestyle protects nerve health, while Western lifestyles often compress them further. Now that we understand what sciatica feels like and how it begins, the real question becomes this: How can someone at home detect whether their symptoms are truly sciatica without needing an MRI or specialist immediately? Because not every back pain is sciatica, and not every leg pain means nerve irritation. There are simple tests used by physiotherapists around the world, and you can try them safely at home with just a bed, a chair, and your own body. These tests don't diagnose the condition fully, but they can reveal whether the sciatic pathway is irritated, compressed, or restricted. In a moment, we'll go through 3 self-tests, step by step. Many people are surprised by the response their body gives during the second one. If you feel discomfort, tingling, burning, or a pulling sensation down the back of your leg during that test, it may signal that the nerve is under tension. And if weakness appears on one side, or if pain shoots downward instead of staying local, that is a sign the nerve may not be gliding freely. Before we begin the tests, keep one thing in mind. Sciatica rarely arrives overnight. It progresses quietly, a stiff evening here, a sharp step there, a numb toe weeks later. The earlier we recognize that this is not just getting older, the easier it is to manage. If you've listened so far and recognized even one of these sensations in your own body, stay with me. In the next section, we'll perform 3 simple movements designed to reveal irritation along the sciatic pathway, and you'll be able to notice what your body is really telling you. Now let's move into the part that many people wait for, the simple at-home tests. These movements are used by physiotherapists to understand whether the sciatic nerve is irritated, and none of them require special equipment. All you need is a bed or couch and a chair. Remember, these tests are not a medical diagnosis. They are early indicators that help you listen to your body. If even one of them recreates the pain or tingling down the back of your leg, especially if it follows that familiar line toward the foot, it means the nerve is responding. The goal is not to push into pain aggressively, but to notice how the body reacts. Sciatic nerves don't lie. They tell you immediately when something is wrong. We'll begin with the straight leg raise test. Start by lying flat on your back on a firm bed or yoga mat. Keep both legs extended, your toes pointing toward the ceiling. Relax your shoulders, take a gentle breath, and slowly lift one leg upward. Keep the knee straight as best as you can. You don't need to reach high. Go only as far as is comfortable and notice what happens. A healthy hamstring stretch feels dull and spread out. Sciatic irritation feels different. If you raise the leg and feel sharp, burning, electric or pulling pain traveling down the back of the thigh, calf, or foot, that reaction is a classic sciatic pattern. Pause there for a moment. Does the pain intensify when the foot flexes toward your face? If bending the ankle makes the sensation stronger, that means the nerve is being tensioned. Lower the leg gently. Repeat on the other side. If one side reacts and the other doesn't, pay attention. Sciatica is often unilateral. Many seniors are shocked by how early this test reveals nerve sensitivity. They expect to feel nothing, but the body responds instantly. You may notice stiffness only in the first 20 to 40 degrees of the lift, or perhaps it feels fine until halfway. Either way, the pattern matters more than the height. Next is the seated slump test, and this one tends to expose irritation even when the first test doesn't. Sit on the edge of a chair, feet flat on the floor, back straight. Slowly round your upper back forward, like you are gently hunching. Then bring your chin toward your chest. Now, extend one leg forward slowly until the knee is straight, keeping the toes roughly pointed upward. Notice what you feel. If the nerve is irritated, even a small lift can trigger that familiar line of tightness or tingling. Some feel a sharp stretch down the thigh. Others feel numbness, like the leg is pulling from the inside. To confirm whether this is nerve-related, gently lift your head and look up slightly. If the sensation decreases when the neck straightens and returns when you tuck your chin again, that is a strong neurodynamic sign. Nerves behave like one long connected wire. Tension in one end changes tension along the rest. This is why this test is so revealing. Perform on both legs, and remember which one reacts more. If one side feels dramatically tighter or more electric than the other, the sciatic pathway is likely irritated. Now for the third test, the toe-heel strength check. Stand beside a wall or countertop for balance. Lift your heels off the floor and stand on your toes. Notice how stable you feel. Then switch. Lift your toes and stand on your heels. If one foot shakes more, feels weaker, or struggles to lift as high, this can indicate nerve involvement. Sciatica does not only cause pain, it can reduce muscle activation because the nerve signal weakens. Many people discover this unintentionally. They think their ankle is getting weaker because of age. In reality, the nerve may not be sending full strength to the muscles. If climbing stairs recently felt harder on one side, or if you occasionally drag the toes without noticing, take that seriously. Weakness is a later stage warning sign and should not be ignored. As you do these tests, something important may happen internally. Awareness. Pain is not just discomfort, it is communication. Your body is trying to tell you where tension lives, where mobility is restricted, and where support is needed. Most people assume sciatica means my back is the problem, but the nerve pathway runs through multiple areas: the lumbar spine, the glutes, the piriformis muscle, the hamstring tunnel. Compression in any of these points can trigger symptoms. That's why some days you feel it in the back, some days near the hip, and other times down the calf. It's not random. It is one long network reacting to daily habits, posture, muscle balance, and inflammation. Now take a moment to reflect on what you felt. During the straight leg raise, did one side tighten earlier? During the slump test, did numbness appear when you tucked your chin? During the heel-toe test, did one foot struggle more? Even a subtle difference can mean the nerve is sensitive. Many seniors wait until symptoms become severe, needing both hands to stand up, losing balance while walking, or experiencing nightly burning. But early intervention is far more effective. The sooner mobility improves, the sooner pressure decreases. And here is where the Japanese approach becomes interesting. Instead of waiting for pain to flare, they maintain daily micro-movements, small hip mobility exercises before bed, gentle nerve glides, slow walking with upright posture, not aggressive stretching, but controlled, mindful motion. They treat movement like nutrition, a daily dose that keeps nerves gliding smoothly instead of being trapped like a tightened wire. We'll dive into that in the next part. But here, before moving forward, let me give you one simple reflection. If even one of these tests triggered discomfort or that recognizable line down the leg, do not ignore it. Sciatica responds best when mobility is restored early. If the nerve remains compressed for months, it becomes stubborn. Muscle weakness follows. Gait changes, balance decreases. Everyday tasks, like tying shoes or stepping out of a car, become frustrating. But the encouraging news is this: when addressed early with the right approach, improvement is absolutely possible, even at 60, 70, or beyond. So now that you've tested your body and identified how your sciatic pathway reacts, the next question becomes, what can you actually do about it at home? How do Japanese seniors maintain nerve mobility and hip strength without heavy exercise? And what routine can you start tonight that gently opens the pathway and reduces tension? In the next section, we'll move step by step through a simple Japanese-inspired relief sequence designed specifically for older adults. No intense stretching, no floor workouts required. Just slow, controlled movements that help the nerve glide freely, ease inflammation, and support pain-free walking again. Stay with me. This next part is where things start to change. Now that you've tested your body and you have a sense of how your sciatic pathway reacts, let us move into something far more hopeful: what you can actually do to reduce the tension, calm the nerve, and restore mobility. In Japan, elderly people rarely let pain settle quietly. They believe movement is medicine, but not the aggressive kind most people imagine when they hear the word exercise. Their routines are gentle, rhythmic, slow, and respectful to the body. The goal is not to stretch until it hurts, but to encourage the nerve to glide, like sliding a thread through a tube without friction. When the nerve can glide freely, inflammation reduces, tension falls, and mobility gradually returns. Many seniors who practice these routines say they feel looser and sleep better after only a few nights. You don't need to do them perfectly. You only need to start. We will begin with a simple nerve glide often used in Japanese rehabilitation clinics. Sit at the edge of your bed or chair, keeping your spine relaxed and both feet on the floor. Slowly extend your right leg forward until the knee is straight, or as straight as is comfortable. Don't force it. At the same time, gently lift your toes toward your face, just until you feel a mild pull along the back of your leg. Now raise your chin slightly, as if looking forward. Hold for 2 seconds, then reverse the motion. Lower your foot, bend your knee, and bring your chin toward your chest softly. This alternating pattern helps the sciatic nerve slide rather than stretch aggressively. Perform 8 to 10 slow repetitions, breathing naturally, then switch to the other leg. Many people feel a warm release or a gentle tingling after a few cycles. That tingling is the nerve beginning to move. If at any moment the sensation becomes sharp or intense, reduce the range. This routine is not a test of toughness, it is communication with your body. The second movement focuses on the piriformis muscle, a small but powerful muscle deep in the hip that can compress the sciatic nerve when tight or shortened. Lie on your back on a firm surface, or remain seated if lying is difficult. Cross your right ankle over your left knee, forming a figure for shape. If lying down, gently pull the left thigh toward your chest until you feel a comfortable stretch deep in the glute. If seated, lean forward slightly from the hips while keeping the spine long. The sensation should feel like pressure releasing, not like electric pain. Hold for 20 to 30 seconds, relax, and repeat 2 more times on each side. Breathe slowly and let your body soften. In Japanese culture, stretching is often performed like meditation, with awareness and patience. The purpose is not to force the muscles to lengthen instantly, but to give them time to melt. When the piriformis relaxes, the sciatic nerve has more room to breathe. For the third movement, we focus on strengthening the hip support muscles. Many seniors avoid strengthening because they fear strain, yet this is where real protection is built. Weak hips allow the pelvis to collapse when walking or standing, placing pressure on the nerve. A gentle bridging exercise can help. Lie on your back, with knees bent and feet hip-width apart. Slowly lift your hips a few inches from the bed, as if forming a small hill. You don't need to go high, just enough to feel your glutes and hamstrings turn on. Hold for 3 seconds, lower, and repeat 10 times. If lying is difficult, you can perform a standing version by holding a countertop and gently lifting one leg backward while squeezing the glute. Alternate sides for 8 to 10 repetitions. What matters is activation. Japanese elders focus on small, consistent movements, not big, exhausting routines. Over time, these small activations build a wall of support around the sciatic nerve. As you perform these exercises, pay attention to how your body reacts. After the nerve glide, does your leg feel looser? After the piriformis stretch, does the hip feel more open, like there is space inside? After the bridging or standing extension, do you feel warmth in the glutes? These sensations are positive signs. They mean circulation is improving, muscle fibers are switching on, and the nerve is no longer trapped. Improvement doesn't always come suddenly. It often arrives quietly. Less stiffness getting out of bed, fewer shocks when standing from a chair, a shorter wave of discomfort when sitting too long. That's progress, and progress is what we are after. One helpful routine used in Japanese rehabilitation involves combining these movements into a nightly ritual. Imagine this as a slow, calming sequence done before sleep. Sit on the bed and perform 10 gentle nerve glides per leg. Lie back or stay seated and perform your figure 4 stretch, holding each side calmly for half a minute. Then finish with 8 to 10 hip activations to remind the body that strength protects the nerve. This can take only 5 minutes. 5 minutes consistently is more powerful than one long session irregularly. Like watering a plant, small daily care works better than dumping a bucket once a month. The body responds to rhythm. While doing this routine, remember that pain relief is not just physical, it is behavioral. The more you avoid movement, the tighter the nerve pathway becomes. But with gentle repetition, the nervous system learns to calm, muscles regain strength, mobility returns, and that burning line down the leg begins to fade. Thousands of seniors in Japan maintain leg health this way, and there is no reason you can't do the same. You don't need to be flexible, you don't need to be strong. You only need to begin with patience, awareness, and softness. In time, the nerve learns to glide smoothly, like silk through a ring. So if 3 simple home tests revealed tension earlier, and this routine felt good to your body, consider making it part of your evening habit. It may become a small ritual that protects your walking ability, independence, and comfort long term. And if your symptoms are strong or progressing, especially if you notice increasing weakness or difficulty walking, always consult a professional. Intervention can help even more when guided. But for many people, these gentle practices alone make a noticeable difference within weeks. If this routine helped, or if you want a part 2 where we explore deeper Japanese hip strengthening or morning mobility versions, let me know in the comments. And if you want to support the channel, subscribe because we share clear science-based techniques to help seniors move with strength and ease, inspired by the Japanese approach to longevity. Thank you for watching, and take care of your body. It is the only place you have to live.